Hey everyone, and welcome to the MediByte channel. I'm your resident healthcare professional, and I'm absolutely thrilled to guide you through today's explainer. We're getting right into a super common, but honestly, frequently misunderstood topic, vaginal yeast infections, or as we call it clinically, candidiasis. My goal today is to give you a complete, really easy to understand breakdown of exactly what's happening in the body. We're going to take the complex science and make it totally clear and accessible. Okay, let's dive into this. Here's our roadmap so you know exactly what to expect. We'll start with what a yeast infection actually is, then cover causes and risk factors, recognizing the symptoms, getting a proper diagnosis, and wrap up with treatment and prevention. All right, Section 1. What is a yeast infection? Let's set up the microscopic world where this common infection actually starts. So the main culprit here is an infectious yeast organism known as candida. Usually, it's a specific strain called Candida albicans. Now, what's genuinely fascinating about this is that candida isn't some bizarre foreign invader you just catch out of the blue. No, it actually resides totally peacefully on our skin and in our intestines every single day. It's just hanging out, living in harmony with the rest of your body. The whole issue only starts when this yeast spreads to the vagina and for a variety of reasons begins to overgrow. It basically disrupts that natural, delicate balance of your internal environment. Now, I want to hit this fact really hard right off the bat. This is straight from the MSD manual. Vaginal yeast infections are not sexually transmitted. I want to completely remove any stigma here. While they can definitely cause some severe discomfort, it's literally just an overgrowth of your body's natural flora, not an STI. So you can absolutely breathe a sigh of relief and let go of any unnecessary anxiety around that. Moving on to Section 2, causes and risk factors. So if this yeast normally lives in harmony with us, what exactly goes wrong to give Candida the chance to overgrow? Now, what's really interesting about this slide is the weird paradox with antibiotics. Let's say you take antibiotics by mouth to cure something else entirely, maybe strep throat or a UTI. Well, those drugs do their job of killing off the bad bacteria, which is great. But accidentally, they act like a wrecking ball and wipe out the good bacteria that normally live in the vagina too. And those good bacteria, they're the exact things keeping the yeast in check. So when the good guys are gone, the yeast essentially gets a free pass to multiply like crazy. But it's not just antibiotics. Certain things basically roll out the red carpet for yeast by changing your hormones or suppressing your immune system. We definitely see higher risks during pregnancy and also for folks with diabetes. A weakened immune system is a major factor too, whether that's from things like chemotherapy or conditions like AIDS. Also, timing matters. These infections are way more likely to pop up right before a menstrual period starts. And interestingly, for women past menopause, yeast infections are actually pretty rare unless they happen to be on menopausal hormone therapy. That brings us to Section 3, recognizing the symptoms. Look, when that delicate balance is thrown off, the physical experience is incredibly frustrating and uncomfortable. Acknowledging that is step 1 to finding relief. So let's talk about what to look out for. The hallmark of candidiasis is usually this really intense itching or burning sensation around the vagina and vulva. The area might get noticeably red and swollen. A lot of women also report severe pain during sexual intercourse. And like we just touched on, you might notice these symptoms flaring up and getting way worse specifically in that week right before your period begins. I want to assure you, if you're experiencing this, you are so not alone and your discomfort is completely valid. But if there is one glaring visual clue that it's time to seek medical help, it's this signature sign right here, a thick, white, curd-like vaginal discharge. Now granted, not every single person is going to have this exact presentation, but it is the classic textbook hallmark of a yeast infection. If you're seeing this, especially combined with that intense itching, your body is sending you a very clear signal. And that leaves us straight into Section 4, getting a proper diagnosis. Going to the doctor for intimate issues can definitely feel a little daunting, but I promise you, getting a professional opinion is a completely standard, non-scary process. Let's move to and see how this builds step by step, so we can totally demystify the exam room experience. First, your doctor is just going to ask a few basic questions about your symptoms, medical history, and maybe recent antibiotic or hormone use. Step 2 is a routine pelvic exam. They'll just take a look at the area and gently use a cotton swab to grab a tiny sample of the discharge. And finally, step 3, they look at that sample under a microscope or culture it in a lab to definitively identify the exact organism causing the trouble. It's super quick, very clinical, and absolutely the best way to get you the right help. Finally, we've made it to Section 5, treatment and prevention. This is the good part. the solution phase where we finally talk about getting you some relief and stopping this from coming back. Because yeast is a fungus, we have to fight back using antifungal medications. And there are 3 main ways we deliver this treatment. You can apply it as a cream directly to the affected area to really soothe that irritated skin. You can insert it into the vagina as a suppository, or you can just take it by mouth as a pill. Looking at this breakdown of your pharmacy options, things like creams and suppositories, you'll see names like buconazole, clotrimazole, or miconazole. These are over the counter. You don't need a prescription, you can just go grab them right now. On the flip side, oral medications like fluconazole or the newer ones like ibrexafungerp, those do require a prescription from your doctor. But here's the cool part. A single dose of oral fluconazole is just as effective as the creams, so it really just comes down to a conversation with your doctor about what fits your lifestyle best. So the crucial point is this safety warning right here, because it gets overlooked way too often. If you decide to go with an over-the-counter cream or ointment, the oils inside those specific products can actively weaken latex-based condoms and diaphragms. That means you absolutely should not rely on latex products for birth control while you're actively using topical treatments, because they could fail. Seriously, keep that in mind. Okay, so once you've successfully treated the infection, how do we keep it from coming back? Prevention is literally all about cutting off the moisture that yeast needs to thrive. Small wardrobe tweaks make a massive difference. You want to keep the vulva dry, which means wearing loose, breathable, absorbent cotton clothing to let air circulate. For folks at a super high risk, like if you have diabetes, a weakened immune system, or you're on long-term antibiotics, your doctor might actually prescribe prophylactic or preventative oral antifungals to stop the yeast before it even gets a chance to take hold. As we wrap up today's explainer, I want to leave you with a proactive question to chew on. Are your daily habits, the clothes you love to wear, or even your necessary medications secretly giving yeast the perfect room to grow? Taking a moment to understand your body's natural balance is truly the best way to maintain your long-term comfort and health. Thank you so much for hanging out with me for this MediByte explainer. I really hope this deep dive into candidiasis gave you the clarity and confidence you were looking for. If you found this helpful, please take a second to like, share, and subscribe to the MediByte channel. It helps us keep making accessible health education for everyone. Stay healthy, take care of yourselves, and I will see you in the next one.